At this point, we're going to shift over to focus on pesticides that are being used for the current public health crisis, COVID-19. Our next presenter is Dr. Mike Igniowski. Mike is a physician with over 40 years in pediatrics. Mike serves as the chairperson of the Environmental Health Committee for the Maryland chapter of the American Academy of Pediatrics. For the past 10 years, he has represented the Academy on the Smart on Pesticides Coalition. Really pleased to have with us today Dr. Mike Igniowski.
Good morning, everyone. It's a pleasure to be speaking to you today and to have the opportunity to bring a pediatric perspective to this conference. Today, I will be discussing hand sanitizers, which are regulated by the Food and Drug Administration, and disinfectants, which are chemicals registered as pesticides with the Environmental Protection Agency. Sanitizers and disinfectants are being widely used, and with COVID-19 cases surging, their use will very likely continue to increase. These products can reduce the presence of coronavirus and the risk of exposure, but there are potential health risks from their use, especially when they are used incorrectly. Some products even have the potential to increase the risk or worsen symptoms related to COVID-19 infections. While children as a group have fared better with this disease than other age groups, they are at greater risk from the adverse effects of these products. Next slide, please. As a pediatrician, it is often necessary for me to remind adults that children are different and cannot be treated as little adults. Their bodies are growing, their brains and organs are developing, and they often depend upon adults for their safety. Children breathe at a faster rate and, relative to their body weight, take in more food and water than adults. If they are exposed to contaminants in the air they are breathing or in the food and water, they will receive a higher dose of these substances and will be more likely to suffer harmful effects. They can't really control what's in their environment and may not have the mobility to escape from a dangerous situation. Next slide. This is a statement from the American Academy of Pediatrics Council on Environmental Health in their policy statement on pesticide exposure in children. Children encounter pesticides daily and have unique susceptibilities to their potential toxicity. Acute poisoning risks are clear, and the influences of low-level exposures on child health are of increasing concern. Children may suffer acute exposures to pesticides by inhalation or ingestion or contact, and they may also experience long-term harmful effects from lower-level pesticide exposures. Next slide. Because children and fetuses are constantly growing and developing, any substance that interferes with these processes can have lasting adverse effects. If brain and neurologic development are affected, this can cause lifelong problems for the child. Because infants and toddlers often crawl on floors, they have increased exposure to any products that are used on these surfaces or which settle on them. As you are probably aware, young children tend to put anything and everything into their mouths, increasing the risk of ingestion. Once these chemicals have been ingested, the immature liver may be less able to detoxify them, further increasing the risk of harm to the child. Next slide, please. Sanitizers and disinfectants are important in decreasing the spread of COVID-19 and in eliminating the virus from high-touch surfaces wherever people may be exposed to the virus. Some products are much safer to use with fewer potential hazards, but their correct use is also critically important. Improper use and handling can lead to health risks, and poison centers across the country noted an increase in calls relating to sanitizers and disinfectants during the early stages of the pandemic. Some disinfectant products can have respiratory effects that could potentially increase the risk for more severe COVID-19 disease. Next slide, please. In trying to eliminate coronavirus, washing with soap and water is a very safe, simple, and effective way to begin. Soap effectively destroys the capsule of the virus, which makes it non-infectious. The physical action of washing removes these damaged viral particles from the skin. Washing hands with soap and water for 20 seconds does the job very, very well. If hands or surfaces are visibly soiled or contaminated, Soap and water needs to be the first step in effective cleaning. Soil and other organic matter will actually neutralize many disinfectants, making them ineffective in eliminating the virus. Next slide, please. The most widely used hand sanitizers are alcohol-based, and the CDC recommends concentrations of over 60% ethyl alcohol or at least 70% isopropyl alcohol to be effective. These alcohols, like soap, also disrupt the viral capsule and are a good substitute at times when hand washing is not readily available. Hand sanitizers are very useful in healthcare settings where providers need to sanitize very frequently throughout the day. They're not meant for use on the rest of the body. Next slide, please. So what are some of the risks? Alcohol-based sanitizers are flammable, so obviously they shouldn't be used near flames. The concentration of alcohol is extremely high in hand sanitizers, so there is a very real risk of acute poisoning if a child ingests even relatively small amounts. As an example, the CDC reported the following case. A preschool-aged child was found unresponsive at her home, and an open bottle of ethanol-based hand sanitizer with an unknown amount ingested was on the kitchen table. The child vomited once in transport to the hospital and was still poorly responsive on arrival at the ER, where her blood alcohol level was 273 milligrams per deciliter. For reference, a level of 80 is the limit in most states for driving under the influence. She was admitted to the intensive care unit and gradually improved, and she was sent home after 48 hours in the hospital. Ethyl alcohol ingestion can also cause low blood sugar and seizures, and acute alcohol poisoning can progress to coma and death. This case illustrates the need to keep any potentially toxic substance well out of the reach of children. You may have also seen or heard news reports recently about hand sanitizers contaminated with methanol or 1-propyl alcohol. Both of these very toxic contaminants may be ingested or even absorbed through intact skin. Methanol ingestion can lead to blindness, seizures, and death. 1-propanol can cause skin irritation, depressed breathing and pulse rate, unconsciousness, and may also cause fatality. At present, only products manufactured in Mexico have been found to be contaminated, and these products have been recalled by the FDA and banned from further import into the U.S. These products can be found at the website listed on this slide, fda.gov/hand sanitizer list, all one word. Next slide, please. Moving on now to disinfectants. These are specifically meant for use on hard, non-porous surfaces. The EPA has a list called List N, which includes over 400 individual products considered likely to be effective against COVID-19 based on their efficacy against similar coronaviruses and other harder-to-kill viruses. The EPA also classifies the active ingredients in these disinfectants in regards to their safety, and the ones that the EPA considers to be safer for use are ethyl and isopropyl alcohol, hydrogen peroxide or H2O2, L-lactic acid, citric acid, and sodium bisulfate. These active ingredients will be listed on the product labels of the various disinfectants that are on the store shelves. Next slide, please. Two other classes of commonly found disinfectant ingredients are chlorine bleach products, in which the active ingredient is sodium hypochlorite, and the quaternary ammonium compounds, also referred to as QACs or quats. These include benzalkonium chloride and a wide variety of other related compounds, many of which end in ammonium chloride. Dr. Rule will be discussing these products and their health hazards in the next presentation today, but I can state that they are not meant to be ingested, inhaled, or injected, and they are not meant for use on skin or on foods. Mixing disinfectants can be especially dangerous. Next slide, please. Combining chlorine bleach with other products is extremely hazardous. As a cautionary tale, here's another case reported by the CDC earlier this year. An adult woman returned from grocery shopping and filled her sink with a mixture of 10% chlorine bleach, vinegar, and hot water in which she soaked her produce. She soon noted the noxious odor of chlorine and developed difficulty breathing with coughing and wheezing. She called 911, and was treated at the hospital with oxygen for a low oxygen level and bronchodilators for her wheezing. Fortunately, she improved with this treatment and was able to go home after several hours of observation. And just to review some of the potential reactions with bleach and other products, bleach mixed with vinegar or other acids produces chlorine gas, as does bleach exposed to heat or mixed with hot water. Bleach and ammonia or ammonium products releases chloramine gas. And both chlorine and chloramine gases are very potent respiratory irritants that can cause lung damage. Bleach mixed with alcohol produces chloroform and hydrochloric acid. Chloroform can cause unconsciousness and potentially fatal changes in the heart rhythm. Next slide, please. It's important to note that pesticides, which are known to be harmful to pollinators and aquatic life in the Chesapeake watershed, are also dangerous to human health, dangers that may be magnified during this pandemic. Organophosphate and synthetic pyrethroid exposure has been linked to respiratory illnesses like asthma and chronic obstructive pulmonary disease, conditions that can increase the severity of COVID-19 infections. Even in the best of times, avoiding the use of such pesticides is critically important for human health and for the health of the bay, its wildlife, and its pollinators. The current pandemic provides even more reason to avoid these chemical products. Next slide, please. This slide just goes over some points to reduce the risks during the COVID-19 pandemic. This pandemic continues to pose great challenges for all of us, and it's important to remember that there are safer products and practices when it comes to using sanitizers, disinfectants, and in pest management. Thank you all, and keep yourselves and your children safe.
Wow. Okay. Thank you, Mike. Oh, what we're going to do now is hold questions, and we'll have our next presentation from Dr. Anna Rule. And because they're similar topics, we'll take questions for both of them when Dr. Rule has completed her presentation. Dr. Anna Rule is an assistant professor, director of the Exposure Assessment Labs, and member of the Education and Research Center for Occupational Safety and Health at the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. Anna has been involved in exposure science research for over 15 years with a focus on environmental and occupational exposure to aerosols, including biological aerosols. She's an expert advisor for the World Health Organization Task Force on personal protective equipment during COVID-19. Dr. Rule?
Thank you, Dr. Allen. So I'm going to talk a little bit on a similar topic that what Mike just talked to us. And I want to thank the Pesticide and the Chesapeake Bay Watershed Project for the invitation to talk to you about this really important topic. So I'm going to talk a little bit about how the pesticide use in the workplaces during COVID-19 and how we're abusing it. Next. So I'm going to briefly talk about how is SARS-CoV-2 transmitted, because I think this is very important in our understanding of why we should be using the pesticides or these chemicals, and what is the real risk of infection by touching surfaces. The mechanism of action of soap, alcohol, bleach, and hydrogen peroxide, like Mike already said, so I'm going to just briefly talk about it. So are we abusing the use of disinfectants? Also briefly touch on the list of from EPA of approved disinfectants and the safer options that we have. And where are people most exposed and who is most exposed? And finally, what we can do to reduce overuse and exposure. Next. So I think it's very important to understand what we know about SARS-CoV-2 and how it is transmitted. It's been evolving, our understanding has been evolving over the time of the course of the pandemic, but right now we have a pretty good sense. So one thing that we have known from the beginning is that the virus is transmitted person to person from these droplets that come from an infected person. These respiratory droplets are emitted from us in very many sizes. It's impossible to classify them in just like above this number, below this number, but there's this range of particles. The larger ones are going to only be in the air for a few feet and then fall by gravity mostly. And the smaller particles are going to stay in the air, and depending on the air conditions and ventilation and other situations, are going to stay in the air for longer and travel longer times also. So next, the smaller particles that are going to stay in the air are going to be breathed in, and so we know how to best avoid those right now, which is by wearing masks. But I'm going to mostly focus on the surfaces that are the bigger particles. So next. These droplets that are emitted, as I said, the larger ones may be able to reach another person that is within 2 feet. And that's why we are recommending to stay farther than that and wearing a mask. But also some of the larger droplets deposit on the surfaces and can remain infectious, depending on the surface, depending on the conditions, depending on many other things, up to a couple of days, but typically within a couple of hours. And of course, the smaller droplets that are the aerosols that can infect. We know that all of these 3 modes of action are possible ways of transmission of infection. And even though we don't know with certainty what is the relative importance of each of them, we do know that the aerosols is the most important route. By now, at this point of the pandemic, we have established that pretty conclusively. What we also know that between 40 and 60% of people that are infected are asymptomatic, which poses a big problem because then we don't know who is infected. So this is one of the reasons we are being even more cautious. Next. So the real risk of infection by touching surfaces, I think, has been a little misunderstood. Finally, the CDC, after many months of investigating and trying to pinpoint this question, has recognized that it isn't thought to be the main way that the virus spreads. The main way is now pretty much established, that is the aerosol inhalation route. There is a long chain of events that need to happen for someone to become infected through contact. Like the person needs to touch a surface where somebody infected has recently been close to, touch the surface with an infected virus, and then touch their face or come in contact with some of the mucous membranes of their face. And that's a long chain of events that is very unlikely. And the most important thing in this long chain, by washing our hands, we're disrupting that chain. So yes, washing the surfaces is important, but also remember, washing our hands may be even more important. Next. So as Mike talked before me, so I'm not going to spend too much time on this, but the viruses are enveloped or contained within this lipid membrane that is easily disrupted by several of the cleaning agents that we use. Most importantly, soap. Soap works fabulously well. Is the one that actually is the most effective in disrupting this membrane and breaking up the virus, and therefore rendering it in non-infectious anymore. So alcohol, bleach, and hydrogen peroxide work in a very similar way. And we're not 100% sure how the quaternary ammonium compounds, or quats, works, but it's assumed to be the same or similar situation. Next. So alcohol denatures the membrane. Mike pretty much went over these and even more detail. So I think I'm going to skip on it. Just be aware that there are some disadvantages or some dangers of working with alcohol. Next. Hydrogen peroxide is relatively safe, especially if used as directed. at the right concentration. 3% hydrogen peroxide is a very effective disinfectant. Most of these disinfectants, another thing is they need certain contact time to be effective. So this is one of the reasons that when we apply it on a surface, like both alcohol and hydrogen peroxide, we need to make sure that the whole surface is wet and then let it evaporate. Don't wipe it out immediately. Don't dry it out. It needs to be let it dry naturally so that the effect of the substance in contact with the virus deactivates the virus. Some of the disadvantages of hydrogen peroxide are if you use really high concentrations, it can be explosive on certain surfaces. And as any other cleaning agent, it should never be mixed with other household agents. Like Mike already mentioned, they are meant to be used by themselves. Next. Bleach is another substance that is very easily and cheap, is widely available at very low cost. It's a very strong disinfectant. Nobody is disputing that, but it has many disadvantages. It has, like Mike already mentioned also, it is easily inactivated by organic material. So if you have some bodily fluids, it's not going to be as effective disinfecting. It is a really strong irritant of the airways. And so people that are using bleach constantly throughout the day, cleaning service personnel are having asthma or other respiratory symptoms that may affect their quality of life. Bleach decomposes under heat and light, so it becomes less effective. And again, it reacts with other chemicals, so it's dangerous to be using it. There are much safer alternatives available. If you need to use bleach, please use it in a very well ventilated area for as short as possible amounts of time. Next. So the other chemical that is many times unknown that we're using it because the ingredients are very hard to pinpoint are called quaternary ammonium compounds. We call them quats or quacks for short. Like I was saying before, the mechanism of action is not completely clear. They are very complex chemical structures, but we know that they do deactivate viruses, bacteria, and other like mold by disrupting the membranes. The same mechanism of action, and Dr. Wilson talked about it yesterday, the same reason why these are effective in killing microorganisms are because of these membranes that are common to all biological systems, like what we find in the environment and ourselves. And so we have to be careful when using any chemical substance. These, same as bleach, they lose effectiveness when mixed with organic matter. They are high irritants. There are several case studies in the literature that have shown that these are producing breathing problems like asthma. They also irritate the skin. And most concerning to me, they have been linked to reproductive and developmental problems in mice. They linger surfaces for many hours, days, and if you keep using the same disinfectant over and over, you can have the disinfectant on that surface until you stop using it. There was a case study in which mice experiment took months after they had been using the quats. They stopped using the quats, and after months, the cages were cleaned. The mice started reproducing again normally. So it's very clearly a developmental agent. And there's a case study next that I wanted to highlight. This is from a nurse, Paxton Barker. In the 1990s, she started using these quats. That's when, more or less, when they were introducing to the market. And they were believed to be safe. So they were used indiscriminately between every patient. many times a day. After a couple of years of using it, she started to develop adult onset asthma. And it wasn't clear what was causing it. It's a very, there are many other ways, other reasons that she could have been diagnosed. So they continued to use the quads. And to the point where she developed this reactive airway dysfunction syndrome that in which the person that has this rat syndrome becomes very reactive to any kind of odor, like other cleaning agents, any fragrance or odors causes her airways to shut down and is impairing her quality of life. So by 2003, she was unable to work anymore. And it has been found, documented that it was the quads that triggers this. And I found a couple of other case studies in the literature. So this is not the only case. There's now several larger studies that have corroborated these asthmatic problems. Next. So I think we are abusing the use of disinfectant, especially because, like I was saying at the beginning, it's not even the main route of action, the touching surfaces. So we do, I'm not saying that we don't need to clean the surfaces, but the emphasis should not be only on cleaning the surfaces, since this new evidence indicates that the airborne is the most important route of exposure. So some of these chemicals, like the quads, if you read the label, they are meant to be used once a week, or at least, at maximum once a day, to clean highly infectious surfaces, like in the hospitals, bed railings, where infectious patients have been. And they're not meant to be used for cleaning personal protective equipment or reusing every time a person leaves, or some people don't understand the labels. They're not clear. The ingredients are not clearly defined. So I think we are overusing these disinfectants that then are washed, coming into the water, going into the bay, and potentially having all these consequences that Vicky was telling us about. Next. Another issue is the concerns about fogging and spraying. This is a huge concern on my part, because by design, these foggers create an aerosol. So they create a system that is going to, or that particles are going to stay in the air and potentially be inhaled and irritating our respiratory system. They will not clean the air. This is a huge misconception. Some people believe that by fogging a room, you're going to clean the air. You're not going to clean the air. The simple particle physics tells us how difficult or almost impossible for particles colliding with each other in this situation. So the chances that you're going to have a chemical in the air colliding with a virus in the air are really minimal. So you're not going to clean the air. The best way to clean the air is with a ventilation system to, remove the air from that place and filter it. Also, it's not a very effective way to cover a surface, because it depends on how do you direct the spray, the particle size, the distance that you have from the surface. So the spray is going to deposit to the surface eventually, but it's not going to cover it like the way where you wet a damp cloth and use the cloth to cover a surface. So spraying has been associated with the increased risk of asthma and respiratory symptoms, but is used indiscriminately in workplaces, in schools, in airports, planes, churches, and it is absolutely unnecessary in my view, and it gives a false sense of security. People think that just because I fogged everything's going to be fine. When the next person that enters and coughs on a surface, you start all over again. Next. So some of the people that are most exposed are in healthcare facilities, of course, because that's where you have the highest concentration of infectious people. So cleaning staff, are using these substances continually throughout the day. Some healthcare workers also are using them to clean their face shields or goggles. In schools, janitors, people sitting at their desks after they have been cleaned. And this includes children. You know, if you're cleaning those desks after every class or 2 or 3 times a day, these kids are sitting at their desk and these substances are being absorbed through the skin. And so we don't know what the health effects are for sure, but just using the precautionary principle should be telling us, don't use them or minimize the use, especially if we have soap and water that we know are so effective. So other workers that we are very concerned about are food processing workers. This is a hugely disadvantaged community. They are being exposed. They are not being given enough personal protective equipment, and they are also at high risk. And other people that are using or misusing or abusing the use of disinfectants, maybe in workplaces or at home. Next.
Couple minutes to finish up, Dr. Roll.
Right. Mike already talked about this, so I'm going to skip this one, but there's a list of from EPA. Next. Just because a substance is in the list doesn't mean that it's safe. We have found 231 quaternary ammonium compounds in the list, 69 that contain bleach. So just keep in mind that just because it's in that list, it doesn't mean that it's safe. They are not pre-market safety testing required for them to be. Instead, I would like to point you to a very nice safety alert flyer, next, that the Maryland Pesticide Education Network has put up. And please read it carefully. It has a very good information. Next. So there are safer options. Just be aware of that. Look for them. Look for resources. There's a lot of options out there. Next. And there are some ways to reduce, like I had just been mentioned, right? Is it necessary? Make a plan. Use them as minimal as possible. And consider changing the process. Maybe you're using these wipes with quaternary ammonium compounds when soap is just as effective or more effective. Next. Yes, next. Thank you very much.
All right, thank you, Dr. Rule. Just amazing information to help us all stay safe. And then a few alerts about biocides that may have some environmental risk. So we have time for a question or two for both of our presenters. So let's use Q&A again for that if you have questions. We see one here from Kai about how important is friction when we're using these disinfectants? How long in washing your hands should you be rubbing, and how important is that friction?
Yeah, I'll answer that. The friction isn't the most important part of washing the hands. It's the contact with the soap product itself that's most important. And the recommendation is for washing your hands for 20 seconds. They often use a way to do that by singing the song Happy Birthday twice. If you don't want to feel like you're aging too much, what I've also found lasts about 20 seconds is the first verse of an old Beatles song, in which I changed the last line from I want to hold your hand to I want to wash my hands. That also lasts about 20 seconds. So if you don't want to feel like you're getting twice as old, twice as fast, you can use that as an alternative. What friction does, along with rinsing, just helps to wash the damaged particles off of your skin surface. So you don't have to scrub your hands terribly hard or use any additional instruments to do that. Just make sure you wash all the surfaces of your hands from your fingertips down to your wrists and rinse them very well after washing.
Okay, thanks, Mike. Another question from Paul about the importance of cleaning food. And I think you mentioned, Anna, something about the use of chlorinated water that for at least one person, when mixed with some other things, didn't turn out so well. And then he's also asking about UV light and its ability to kill the virus.
So yes, definitely UV light has been shown. We don't consider it a chemical; it's more of a physical agent, so that's why I didn't mention it. But it's also harmful. UV light is in the spectrum, in the electromagnetic spectrum, where it can damage our eyes and our skin. So it has to be used very carefully. It typically is pointed away from people towards like the ceiling to help with the air. So really, soap and water.
Okay, soap and water. Yes, all right. Well, thank you again, Anna and Mike. Really great information for us all to hear at this time. Hopefully none of those biocides appear in the environment in ways that present risks, but we will be mindful of that as we go forward. So thanks again, great presentations.